Chapter 9, the immune system and mechanisms of defense, screencast 5. Now, this last screencast, and this is something the book spends a lot of time going into a lot of detail, is actual AIDS. AIDS, or otherwise acquired immune deficiency syndrome, and it's caused by the HIV virus, which stands for human immunodeficiency virus. We talked about this a little earlier, and this is a virus that specifically targets helper T cells. So HIV attaches to the receptors of helper T cells, and that's how it gains entry to the cell. How it's transmitted through bodily fluids, so blood, semen, breast milk, and vaginal secretions. So that's typically the normal transmission of the HIV virus. Here we can see the virus, so the viral core, the enzyme, and the single-stranded RNA, and all the other characteristics that we expect to see in a virus. And note the size, 100 to 140 nanometers. Really small. Now, HIV is actually a retrovirus. We can kind of take a look at the overall mechanism of how it actually infiltrates into cells. So here we see the viral RNA making its way into the cell, and that viral RNA actually becomes incorporated into DNA that was made from the RNA. So now there's this new DNA that has the virus incorporated into it. It moves into the nucleus, okay? And now that's going to reside there. And the next step is we're basically going to see that DNA dictating the production of the viral coat, the various proteins, and actually the core of the virus itself. And now we basically see the actual replication of that virus. So that process overall that we see. Now, AIDS has a number of phases, and it is a disease that's known for developing slowly. Phase 1, this can last a few weeks to a few years. Originally, there's going to be some flu-like symptoms, and this is very characteristic of most viral infections, flu-like symptoms. Then they'll start to see swollen lymph nodes. Patients will be experiencing chills, fever, fatigue, and body aches. And once again, none of that is really different from flu or other mild virus cases. So most people really don't exhibit recognizable symptoms. At this time, the virus is multiplying, antibodies are being made, but not enough, and it's ineffective for complete removal of the virus. Phase 2, this actually occurs within 6 months to 10 years. It's characterized by opportunistic infections. We'll see some examples of those. Typically a very big impact on helper T cells. The numbers of T cells are dropping dramatically. If this is left untreated, 95% will progress to the next phase, and this is actually AIDS. So clinical AIDS is phase 3. The count of helper T cells is well below 200 cells per cubic millimeter. And this is what we meant by opportunistic infections and cancers. So tuberculosis, pneumonia, meningitis, encephalitis, Kaposi sarcoma, that is a cancer that's very specific to AIDS, non-Hodgkin's lymphoma. And if untreated, we're talking about a disease that's always fatal. Here it basically talks about the transition in which we're going from overall the amount of virus, okay, that we see. And a couple of things that I want to point out. So we're looking at a timeline in years, and basically the concentration of the helper T cells is what we look at here, okay? And then really what we're looking at is that big drop in the T cells, okay? And here really what we're looking at is the amount of virus in blood. So high up in the beginning, okay, but notice the antibodies. Eventually the antibodies start to fall, T cells fall, and then we start to see a significant rise in the actual virus. This is a very variable timeline and is definitely patient dependent. Now, worldwide, we're talking about more than 35 million individuals infected with HIV. We're looking at up to 39 million dead to this point. The majority of infections have been in sub-Saharan Africa, and there's been an increasing spread in Asia and India. In the United States, AIDS accounts for about 14,000 deaths per year. There's probably over 500,000 people living with AIDS in the United States. And then there's probably an additional 700,000 that are infected but not yet symptomatic. So here we can basically see that living with AIDS and versus deaths, and that really is starting to be on the decline. And I'm going to talk a little bit about that. And you probably have seen a number of commercials on television for a new series of drugs that are being used to treat HIV. Now, one thing that we do know, risky behavior significantly increase your chance of getting AIDS. Males account for about 3/4 of cases. Typically, it's sex with other men, sharing needles during intravenous drug use, or heterosexual sex with HIV-infected female. Women account for about 25% of the cases, typically sex with HIV-infected male, or sharing needles during intravenous drug use. So big difference in males versus females overall. Here we just got a couple pie charts that basically really illustrates that. If we look at males, it's typically almost 60% sex with other men. If we look at women, 50% is actually due to heterosexual contact. So something to keep in mind here. Now, if you're looking at making sex safer, abstinence, reducing the number of sexual partners, choosing sexual partners that have low-risk behavior, avoid high-risk sexual practices. Anal genital sex is a very high-risk practice. Use latex or polyurethane condoms or barriers, nonoxynol 9 spermicide, and most importantly, getting tested. That's probably the most important thing overall. Now, there's a lot of new treatments, and as I said, you've probably seen some commercials, and really what these are actually doing is keeping the virus count so low that these individuals are asymptomatic and not capable of transmitting the virus. So these are game changers. So let's kind of take a look. Some of these are older drugs, but not like the new drugs that I just kind of addressed. Some of them work by inhibiting the entry of HIV into the host cell, inhibition of enzymes that are necessary for the replication of viral RNA. So they're known as reverse transcriptase inhibitors, prevention of insertion of the viral genome into the cell's DNA. So these are integrase inhibitors, inhibition of enzymes required to assemble the viral proteins. These would be protease inhibitors. Early treatment with drug combinations may delay or prevent clinical AIDS. Also vaccines, but it's been very difficult to create a vaccine for HIV and AIDS due to the fact that it mutates very regularly. So it's very difficult to create a vaccine for a virus that has a high rate of mutation.